Have you noticed your legs feel heavier than they used to? Maybe you find yourself using your hands to push off your knees just to get up from a chair. Climbing stairs now feels like lifting weights. Or you catch yourself stumbling, even just walking across the living room. Most people shrug it off and say, "That's just aging." But here's the truth. These are not just signs of aging. These are warning signs. And they point to a condition that is quietly stealing your strength. Sarcopenia, or age-related muscle loss. The scary part? You could lose up to 15% of your leg strength in just 5 years after turning 60, without noticing. No pain, no swelling, just weakness that creeps in quietly until one day you need help getting out of bed. The good news? You can rebuild leg strength in just days, not months, days. Not with expensive therapy or intense exercise, but by giving your body the 3 vitamins it is quietly begging for. Vitamin D3, vitamin B12, and vitamin B1, also known as thiamine. Each one plays a unique role, and each one becomes dangerously low after 60. Let's break down how they work, and exactly how to use them safely and effectively to see fast results. First, vitamin D3, the master switch for muscle activation. Vitamin D3 is more than just a bone health nutrient. It acts like a master switch for your body's entire muscle and nerve system, especially after the age of 60. As you grow older, your skin becomes thinner and less efficient at producing vitamin D3 from sunlight. You likely spend less time outdoors, and your liver and kidneys, the organs responsible for converting inactive vitamin D into its usable form, start to slow down. The result? A silent deficiency that weakens your body from the inside out. When D3 levels drop, your nervous system starts to misfire. Nerve signals take longer to reach your muscles. Your muscles begin to respond sluggishly. Everyday tasks, like climbing stairs or standing up, suddenly feel harder. Worse, your balance begins to deteriorate, increasing your risk of falls. Common warning signs include heavy, stiff-feeling legs, cramps in your calves or thighs at night, difficulty with stairs or hills, pain in joints, especially hips, knees, or heels, tripping more often, even on flat surfaces. These symptoms are often mistaken for aging or arthritis, but they are frequently early signs of D3 deficiency. According to research from the University of Birmingham, seniors who took just 800 IU of vitamin D3 daily showed a 19% increase in leg strength in a matter of days. Harvard researchers also found that seniors with healthy D3 levels had fewer falls and significantly better mobility. For adults over 60, the recommended dose is 800 to 2,000 IU of vitamin D3 per day. It should always be taken in the morning with a meal that includes healthy fat, like eggs, avocado, or salmon, since vitamin D3 is fat-soluble and needs fat for proper absorption. Avoid taking it late in the day, especially near bedtime, as it may interfere with sleep in some individuals. This one nutrient can make the difference between walking with confidence or needing help just to stand. Replenishing it daily can activate muscle fibers, restore nerve function, and protect your mobility as you age. Second, vitamin B12, the brain-to-leg connection. Vitamin B12 is often called the memory vitamin, but for seniors, it's far more than that. B12 is the nutrient that allows your brain to talk to your muscles. It ensures smooth, fast communication between your nervous system and the muscles that keep you standing, walking, and balanced. Without it, your legs stop responding properly, even if your muscles are physically intact. After age 60, the body's ability to absorb B12 drops sharply. One major reason is reduced stomach acid, which is necessary to extract B12 from food. Many seniors also take medications like antacids, proton pump inhibitors, or metformin, all of which further impair absorption. So even if you're eating meat, eggs, or dairy, your body may not be absorbing enough B12. Common symptoms of B12 deficiency include numbness or tingling in the feet and toes, weakness or heaviness in the legs, trouble maintaining balance, especially on flat surfaces, brain fog, forgetfulness, or mild confusion, a general sense of feeling unsteady or disconnected from your body. These symptoms are often mistaken for signs of aging, but they are classic red flags of B12 deficiency. A study from Oxford University found that older adults with low B12 walked more slowly and were over twice as likely to fall. Another clinical trial showed that supplementing with 1,000 mcg of B12 daily led to better stability, improved lower body strength, and faster reflexes in just weeks. Recommended dosage. Seniors should take 500 to 1,000 mcg of methylcobalamin, the active form of B12, daily. Methylcobalamin doesn't require conversion in the liver, making it ideal for older adults. Choose chewable tablets or sublingual lozenges for better absorption. Avoid taking B12 with tea or coffee, as these can interfere with nutrient uptake. Take it mid-morning or with lunch for best results. Restoring B12 isn't just about sharper thinking, it's about regaining control over your body. It can mean the difference between walking with confidence or needing support just to stay upright. Third, vitamin B1, thiamine, the energy engine. Vitamin B1, also known as thiamine, is the spark plug of your muscles. If vitamin D3 activates the system and B12 connects your brain to your body, then B1 provides the energy your muscles need to actually move. It converts carbohydrates from food into ATP, your body's primary fuel for movement. Without enough B1, your muscles don't run out of strength, they run out of fuel. After age 60, thiamine deficiency becomes increasingly common. The body's ability to absorb it declines, and many common medications, including diuretics, metformin, and antibiotics, flush thiamine out of your system even faster. Even moderate alcohol use can interfere with B1 absorption, making low levels more likely even in people with good diets. Symptoms of low vitamin B1 include leg fatigue or weakness after mild activity, muscle cramps, especially in the calves or feet, feeling out of breath on stairs or slight inclines, general mental tiredness, sluggish thinking, low physical motivation, lack of drive to move. These symptoms are often chalked up to just aging, but research shows otherwise. A study from Tokyo University found that 30% of older adults had low thiamine levels. After supplementation, most participants reported increased energy, longer walking distance, and easier stair climbing. Another study published in the Journal of Neurological Sciences found that 82% of patients with leg fatigue reported improvement within just 7 days of daily thiamine supplementation. Recommended dosage. Older adults should take 50 to 100 milliliters of thiamine per day. It's best taken with breakfast and should be paired with protein or healthy fat, like eggs, cheese, or nuts, to improve absorption. Avoid consuming alcohol, black tea, or coffee near the time of supplementation, as these can reduce the vitamin's effectiveness. Thiamine works quietly, but its effect is powerful. With the right dose at the right time, it can restore the drive to your legs, bringing back not just strength, but the motivation and stamina to move through your day with ease. How to combine for maximum effect. Morning. D3 plus B1 with eggs or yogurt. Lunch, B12 with fish or legumes. Avoid all three on an empty stomach. Multivitamins often underdose these three. Always read the label, and always take with food. Safety tips. Don't exceed recommended doses. Talk to your doctor if you have kidney, liver issues. Track symptoms and blood levels every 6-12 months. Final reminder. This isn't about getting younger. It's about staying strong, reclaiming your balance, moving without fear, getting your legs back. D3 turns the system on. B12 reconnects the wires. B1 gives the engine fuel. This is your moment to act. Don't wait for the fall. Take the step before you lose the strength to step. Your independence may depend on it.